Welcome back to the Non-Traditional Veterinarian, and we're going to talk about poop today because my dog had diarrhea recently. Pretty sure it was attributed to the dental cleaning he had. If you did not listen to bonus episode 5, I talked about dental cleanings, and it was prompted by a dog parent just like you. And my dog had diarrhea from his dental, likely. So I want to talk about what I did and what I didn't do, because diarrhea is something I commonly see in my patients in day-to-day practice as I'm traveling hospital to hospital, and it can be caused by a variety of reasons. I also think there's multiple ways that you can support your dog with diarrhea that go beyond the traditional metronidazole and plain chicken and rice. Now, sometimes we need one or both of those things in a temporary moment. But I think it's really good to, again, do the panoramic view and look and see what we can do to support them, not only in that moment while they're having diarrhea, but what we can do to support them so that way we're not affecting them in the long term. And so I'm going to share exactly what I did. And maybe you can think about this the next time your dog has diarrhea, because am I right that the diarrhea always happens at the worst time? It's in the middle of the night when you're looking forward to a night of sleep, or it's right before you go to work, which is what happened to me, or it's right before you're going on a trip. It is never just at the perfect time. And so here are ways that you can support your dog. So I have everything listed for me so I don't leave anything out. And so what triggered my dog's diarrhea was likely the anesthesia, maybe the stress from him being at the hospital, although he loves the hospital and he loves the people where I had his dental cleaning done. I think it was just the perfect storm. And I also think that I acted promptly enough because my dog he doesn't vomit, he doesn't have diarrhea. It's not normal for him. Spoiler alert, that's not normal for any dog. It just means it happens commonly, but just because it's common doesn't mean it's normal. And so I was walking him the 2 days after his dental. So he had a dental on a Tuesday. Thursday morning, I was walking before I went to work. I thought it was a little bit odd that after he was sitting there hunched for a while, and I was like, "Are you straining?" And I was like, "Ooh, is that diarrhea?" And I was like, that's a little bit softer." We continued on our walk, and as we went farther on our walk, he went to go to the bathroom for a second time, which is very unlike him, and it was the squirts, if you know what I'm talking about. And I was like, this is not like him. And so, of course, I was headed into work that day, and that hospital graciously told me at the end of my shift, they're like, hey, in the future, if you ever need to bring him, you can. And so, what I did is I took him to a hospital that I know loves and adores him, and they watched him for the day. I talked to the team, they let him out several times. They know what to look for. They know that if he's getting restless in his cage, he probably has to go. And I didn't want to leave him at home, A, so I can monitor him, and B, I could start the meds that I wanted to start for him and the support. And C, or three, what A, C, three, four, I could have him taken out because I know my dog is so house trained that he would hold it until the last very moment because he's so sweet. And he would feel so guilty about going. And I'm gonna be honest, I didn't want to come home after an 8-hour workday or a 9-hour workday and have to clean up dry diarrhea. Like, who wants to do that? So I've seen it 1,000 times in practice, and it absolutely hits different when it's your own dog. Because you're like, oh my gosh, how long is this going to go on for? I had a feeling I knew what it was from. He didn't get any antibiotics from his dental cleaning. He didn't get any pain meds because he didn't have any extractions. It was likely just the recipe of anesthesia, a little bit of stress from being at the hospital, and maybe even some bacteria being translocated, escaping his dental health. He didn't have bad dental disease. So it's likely, again, this perfect storm. And there's nothing we can do sometimes to prevent it, but what can we do to help manage it? And so what I didn't do is I didn't do metronidazole. I didn't do it. I didn't lean on it. I know that that's a tool in my toolbox if I need to. I didn't do it. And I didn't do plain chicken and rice. And I'm going to explain why I didn't do either one of those. So the metronidazole, it can be a short-term band-aid. Sometimes we need it in cases. Sometimes it can be very beneficial. Also, we have to look at what is the cascade that happens afterwards. So metronidazole can influence Fusobacterium. That's a type of bacteria that can be very important in your dog's digestion. So that antibiotic that we're giving, it doesn't just go to your dog's colon. It doesn't go to the poop maker. That antibiotic is affected everywhere. And so I, as of right now, May 2025, feel that sometimes metronidazole is used a little bit too frequently. There's been several studies lately that show that 80% of diarrhea, so not 100%, but 80% of diarrheas are food responsive diarrheas. So if we treat them with some supportive care through nutrition and just give it a little bit of time, we can get that stool back to normal. And when we use it sometimes, and it's used too frequently, that can have a long cascading effect on our dog's health. And so I knew that. And so I didn't want to rely on it, but I knew it could be a toolbox if I needed it to. I didn't want to help treat something that was very temporary, very acute. And yes, you do need to address diarrhea because there can be issues in the future. Your pet can get dehydrated. It can absolutely be a sign that there's something else going on with your dog. I also knew that I didn't want a temporary fix for a potential long-term issue. So I didn't rely on metronidazole. I knew that I would need it. I didn't even have it filled. I didn't even order it for my dog. I also didn't do plain chicken and rice. And why is that? Yes, he needs something bland. Yes, he needs something that's gentle on his stomach. I also know that that's not balanced. It's not formulated in a way to help meet the requirements that he needs. When your dog is having diarrhea, when your dog is having vomiting, yes, things that are easily digestible, but that's the gut saying there's inflammation. There's an insult there. There's something that is upsetting it. And if we're not giving the proper nutrition that it needs, the proper healing properties, what it needs to heal and repair itself, we're not seeing the whole picture here. We're calming things down, but are we helping build them back up? And that's what we want to do with a formulated, I'm even hesitant to say the word balance because I just think it's so overused these days. In a balanced, formulated, gentle, easy to digest recipe for him. And that can be ingredients. It also can be the type of food that you're feeding. I think the intent is good there with plain chicken and rice, that it's not ultra processed. It just doesn't fill all the gaps, especially if we're going to do it for several days. A meal, is it the best? I'm gonna be honest. No. Is it the worst? No, either. So I didn't rely on plain chicken and rice for my dog. What I did do is I did a stool firmer. I put him on some Endosorb to help firm up the stool. I made sure that he was still going to get his probiotic. I was focused on inflammation. I was focused on repairing him. So I relied on first, let's firm up the stool because that's the issue here, right? Is he's having diarrhea. I don't want him getting dehydrated. I don't want, I'll be honest, the inconvenience of trying to figure out what to do so that he is comfortable. And I guess I wouldn't even call it an inconvenience. I would look at it as like rearranging my schedule, rearranging priorities so that he could be the priority. So that's what I focus on is let's firm up the stool first. And so that is helpful to help stop this cascade of the bad bacteria going in and like taking charge and the good bacteria retreating. Gut health support. So I didn't do any specific testing because I was pretty sure that this was a result of the dental and not that there was anything wrong with the dental cleaning itself. It was just, again, the perfect storm. It happened. It didn't happen after his dental back in November 2023. Unfortunately, sometimes these things happen. It's not going to stop me from having a dental cleaning on him in the future either. So what I did was I did gut healing support. So I focused on making sure that he was well hydrated, making sure that he was getting proper nutrition to help heal his gut. Other things I would have considered had it not improved literally within 12 hours, I probably would have leaned on supplements like slippery elm or glutamine for him to really help nurture the inflamed gut that he was having. I also did a very nutrient balanced, easy to digest food. What does that look like? So it is his normal food, but I made sure that he was not eating his air-dried kibble. And while air-dried kibble is way less processed than ultra-processed traditional kibble, I wanted him on something even more digestible. So I fed him his fresh food. I know he does well on it. It is very easy to digest. It is not ultra-processed. And so that's what I leaned in for him. If I would have had to have cooked him food to formulate it, I would have. I also know that I don't have those supplements on hand to make sure his micronutrients are being fed properly to be able to have that gut healing for him. So I leaned into not only something that I felt was proper, that didn't have a lot of inflammation in the ingredients. I didn't making sure he wasn't getting seed oils, an overabundance of those omega-6 oils. I did a podcast on that. Absolutely invite you to listen to that one. I also was not going to feed him an ultra-processed food because I knew that any added inflammation to him was just going to make this longer for him to improve. And what was it going to do in the long term? So it's very easy when your dog is having vomiting or diarrhea to think, fix it right now. And I get it. I absolutely get it. I was on my way to work when this happened. Literally was going to leave my house in 15 minutes. Yes, we want to fix it so they can feel better and so that we can do whatever we were probably in the middle of doing, sleeping, going to work, going on a trip, but also how can we be focused on what it's going to do for their long-term health? And that's where my mind was. And so on day one, immediately he got the Endozorb. I was focused on a very recipe formulated, balanced, easy to digest, not ultra processed food for him. He had a good appetite. He was bright and alert. I didn't feel like we needed to go down a rabbit hole of anything else. And sometimes when our dogs get diarrhea, sometimes their stomach does get upset. Think about the last time you had an upset stomach. Maybe you had some food poisoning. Maybe for whatever reason you had a little loosey-goosey stool or you were vomiting. That affects your appetite. I'm not terribly alarmed when owners bring their pets in and they are vomiting or they're having diarrhea and they're like their appetite's off. It's something that I pay attention to. But I'm also like, okay, how can we support them based on the history? Like, why do we think this happened? And it's something I want to say too, when we're like, we don't know why it happened. I think sometimes we lose sight of the pet's past history. How long has this dog been on antibiotics beforehand? Or allergy meds? Or what's this past history? What does it look like? Because it's really important because that could have set us up for this potentially and what we have going on now. And so gut resilience is really important for your dogs or your cats, your pets' long-term health. When they have a healthier gut, they can have healthier health. And I know that sounds really silly, but less likelihood of allergies, less likelihood of autoimmune conditions, less likely of inflammation, which is the root cause of so many diseases. So yes, diarrhea is an annoying mess. It also can clue us into what's going on with their health, depending on if we can figure out a cause or not. And what is that cause? And what's the significance of it? What is the likelihood of it repeating? But also their long-term health. Their gut health is their whole body health. And so it's very important to treat it, but how can we prevent it? How can we nurture that gut? So hopefully we're not being set up for this cyclical repeat infinity sign situation. So if your dog has diarrhea, I really want to encourage you that, and I see this quite a bit, is owners will come in and be like, I just want the metronidazole. And I get it. I also want something for my pet that I know is going to help them. But let's take a step back and let's also think about what these meds are doing for them long term. Is this why your dog is in there again with repeated diarrhea? Is this why your dog is having recurrent urinary issues? Is this why your dog is having repeated allergy issues? Is this potentially why your dog developed a random autoimmune condition? Again, there's other things to look at, lifestyle, environment, nutrition. But this is really, really important, is looking at this, is that if your dog is on metronidazole several times a year, especially without a probiotic, that is what breaks my heart, is when I see dogs, they're coming in for a recheck or coming in and they're wanting metronidazole again, and I see the metronidazole has been scripted without a probiotic, it breaks my heart. Because dogs need probiotics as well when they're on the metronidazole to help preserve the good bacteria. Because that metronidazole is not just going in and killing the bad bacteria, it is going in and clearing everything. And I think that there's a way to support our patients, your pets, with really wonderful future health focused supportive care. Other things I did for my dog that I may have forgot to mention is I was focused on inflammation control. So he is on a turmeric-based supplement. I made sure he got that. And I added bone broth to his food. Just a little bit more nurturing for the inflammation, a little bit more nurturing for the gut. I know bone broth can be a little controversial. Some people swear by it. Some people are like, I don't know. I knew it wasn't going to hurt him. And I was like, anything I can do to help repair his gut. And what's really cool sometimes, this may get a little science nerdy on you, is that you can tell kind of sometimes where the inflammation is going on based on the diarrhea or the vomiting. Okay, if it's vomiting, it's very possible it's upper GI, although I've seen some dogs obstructed with foreign bodies that were a little bit lower in their GI tract and they vomit because things get backed up. But because his stool was very liquidy, and he was starting to have some frequency to it. Sometimes you can discern if it's small bowel, small intestine, or large bowel, colon. And so again, that gives us more information. So I really believe that there's a way to support your dog with their diarrhea. And knowing that you have tools in your toolbox if you need them. You have the metronidazole. You have other antibiotics if you need them. But maybe let's take a step back and think holistically on this, and not holistically like we're anti-medicine, but holistically thinking about all of it and think about, okay, and sometimes we have to rely on the metronidazole, but let's absolutely do probiotics. Let's absolutely talk about how can we do bland or easily digestible, formulated, balanced nutrition that is easier on them. And not just because of the ingredients, and not because it's labeled digestible, but also less processed food. Again, so we're not adding inflammation to it. Think about this long term. I didn't skip a beat when my dog got diarrhea. I knew that this was what I was going to do. Now, if I had to change course, I could change course. But let's be mindful that when we give things, that they may show up in unrelated ways down the road. And it's very easy for us to not make these dots connected when really, in fact, they may be connected. So, some takeaways for you is we don't always need to rush to antibiotics. We need to support the gut. We don't need to silence it, but we need to support it and support it in a way that allows it to heal, not just silence the issues. And a bland diet doesn't have to be boring, like plain chicken and rice. It doesn't have to be biologically inappropriate. But how can we do it so we can support them through this? So I hope that that brings you a little clarity. I hope that your dog doesn't have diarrhea, but if they do, again, it gives you some things to think about, tools in your toolbox, so that you can decide what is best for them. And if they're a dog that is repeatedly having diarrhea, repeatedly being prescribed metronidazole, are we just repeating a cycle here? What's the bigger issue? Is it now that we really need to repair the gut bacteria, or if there aren't any antibiotic repeatedly? We need to think about this and how it's setting them up for health long term. How can we help them live better so they can live longer by your side? So I hope that brings you some clarity. I'm rooting for you. Again, don't be scared to ask the hard questions or just ask politely to your veterinarian, what are some other options? Or, hey, can we try this? And if it's not getting better, in what time frame should I look to start these other things that are more traditional? Ask those questions. Those are okay to ask. And if I may ask you a question, if you've not had a chance to review, leave a beautiful review on this podcast, whether you're listening on Apple or Spotify, or maybe you're watching on YouTube. If I may ask you and invite you to leave one, I would greatly, greatly appreciate it. Until next time.